So I think in order to keep us on time, we'll get started. I wanted to, I'll start by introducing myself. My name is Megan McCaffrey. I am the Vice President of Communications for RCAP Solutions. And I just want to say welcome to everyone who has joined us this afternoon. We're thrilled to see a good turnout this afternoon. This is our first time promoting this coalition and the initiative in this way to the general population. So we're excited to have you all on board. I'm going to also start out by saying that Madison Wellman is going to be our presenter. He's our lead on this program from RCAP Solutions, and he's having technical difficulties. So I'm going to ask you to bear with us. I will, like I said, I will kick off everything this afternoon, but I just wanted to again say welcome. So we can move on to the next slide. So we have a couple of small housekeeping tips that I want to quickly mention. Before we get started, I'd like to just let you know that we have a lot of information that we'll be covering with you today. We'd like to ask you to keep yourself on mute while we give the presentation. There will be an allotted time at the end of the meeting for live questions. You can also use the chat box at any time if you have a question, and we will try to address the questions as they come in. We will provide contact information and a link to join our coalition at the end of the presentation. The meeting is being recorded and it will be available afterwards. It will be on our YouTube channel, and we will also circulate it to anyone who has attended. If you have any questions, we can also provide the slides from our program and any additional information that you want. If there's anyone who you know of that you think would benefit, you are more than welcome to forward this information, the recording, the slides, any information to them to help us to spread the word. And we'd be happy to provide any follow-up information if there are any questions. So don't worry if you miss any slides.
Megan, I've made it into the call now.
Oh, welcome, Madison.
Hi, thank you so much. It sounds like we've made it through the housekeeping items, so I'll dive right into the introduction from here. Does that sound fair?
Perfect. Thank you.
Outstanding. Sure thing. So sorry about the confusion and the technical difficulties, everybody. Thank you all so very much for joining us today. My name is Madison Wellman. I am the Coalition Manager for RCAP Solutions. I'm joined today by Amy Shea from the Health Foundation of Central Massachusetts, Jim Starbard, also from RCAP Solutions, and Kim Dash from the Education Development Center. In a moment, I'll pass your attention along to Amy and Jim to discuss the Health Foundation for Central Massachusetts and RCAP Solutions' private well program to protect public health. Later, Kim will speak on the evaluation of our private well project and the impact our work has already yielded before turning the discussion over to you all for a brief Q&A. But first, I'd like to fill all of you in on RCAP Solutions and how the Coalition for Safe Drinking Water came into being. RCAP Solutions is the Northeast and Caribbean affiliate of the Rural Community Assistance Partnership, which supports small communities to promote public, environmental, and economic health. We engage in this work throughout all 6 New England states, New York, New Jersey, and Pennsylvania, in addition to Puerto Rico and the U.S. Virgin Islands. Our holistic approach to rural development has led us to work in a wide variety of subject matter areas, including affordable housing, utility mapping, and entrepreneurial assistance. But the largest of our programs is the technical assistance, consulting, and training that we provide to rural drinking water and wastewater system operators. Through our work with public drinking water systems, our team became aware of the lack of understanding among the general public regarding the risks of private well contamination. To educate the public of these risks and to build a solution to the private well contamination problem, RCAP Solutions was lucky enough to partner with the Health Foundation of Central Massachusetts to create the Coalition for Safe Drinking Water. Through this coalition, RCAP Solutions and the Health Foundation of Central Massachusetts seek to raise awareness of well contamination and to pass a legislative solution to this problem within the Massachusetts state government. And with that introduction, I'll pass your attention along to Amy Shea from the Health Foundation of Central Massachusetts.
Thank you, Madison. Glad you were able to join us. And thank you to all of you joining us today. Nice to see some familiar faces and many new ones. I just wanted to provide a little bit of background about the Health Foundation and explain our involvement in this project, as it probably seems a little atypical for a foundation to be so involved. So we are the Health Foundation of Central Massachusetts, based in Worcester, but serving all of Worcester County and some of the surrounding towns. And we have a mission to improve the health of those who live or work in Central Massachusetts, although many of our projects end up taking us statewide, such as this one. Next slide, please. One of our major grant-making initiatives is known as the Synergy Initiative. These are multi-year, multi-million-dollar grants that make up about 75% of our annual grant-making. We typically have about 4 projects in each round, and each project typically receives about $2 to $3 million in funding over a roughly 5-year grant period. These are collaborative projects, such as this one, that target health issues in Central Massachusetts and beyond, with comprehensive strategies aimed at systems and policy change. Next slide, please. So this is just an infographic about how the Synergy Initiative works. So this particular project began in 2020, starting first with a planning year, followed by a 1-year pilot, and we'll be sharing some of the data from the pilot year a little bit later, followed by implementation, typically for 1 to 3 years. We're currently in the first year of implementation, all leading towards systems change to be able to sustain these strategies and expand their impact. You'll see that evaluation occurs throughout this entire grant period. So Kim Dash, whom you'll hear from shortly, she's actually been involved in this project since '99, before this project was officially funded. Next slide, please. So a little bit about the origins of the project. This first came up several years ago, around 2017, when RCAP Solutions first approached the foundation about a project to expand their existing EPA program to provide more in-depth water quality testing and technical assistance to homeowners in Central Massachusetts. RCAP has had a long-standing contract with the EPA to provide private well assessments, but really had not been able to conduct water quality testing. And so this was their attempt to expand into that important work. We recognize the importance of this project and encouraged RCAP Solutions to consider applying for our Synergy Initiative rather than our typical 1-year grants, which is what RCAP had initially approached us about. Next slide, please. And the reasons why the foundation became interested in this issue is that, many of you are likely aware of the fact that approximately 500,000 Massachusetts residents, likely more, rely on private wells for drinking water. These are estimates because, unfortunately, there is no statewide database of private wells, so we don't actually know exactly who has private wells, but current estimates are that roughly 500,000 up to 1 million residents rely on private wells. And you are likely also aware of the fact that there are no statewide regulations that ensure that private well water is safe to drink. For individuals that live in more urban areas, this likely comes as a surprise. For those of you that are on boards of health in towns with private wells, I'm sure you know this very well. And there are countless contaminants that one may need to be concerned about and be aware of. I know PFAS was mentioned several times as we were beginning the meeting, but there are other contaminants as well, like E. coli, arsenic, and uranium. Next slide, please. And just a snapshot of actual private wells collected through RCAP Solutions field work. These are actual private wells in Massachusetts, and really highlight the outcome of not having any regulations is that you have some very poorly maintained private wells, and unbeknownst to many homeowners, they continue to drink water coming out of these wells, not knowing if they are safe to drink or not. Next slide, please. Okay, so next I'll turn it over to Jim Starbard.
Thank you, Amy. Good afternoon, everyone. Thank you for being here. I'm Jim Starbard, the Regional Director for Southern New England, and I'm going over a little bit about the program so far. So we began in 2020, a great year to begin a program, but we worked our way through it. And it was a 5-year program. Really, we had goals to educate private well owners on wells and testing, knowing that we were going to do testing, but we weren't going to get to every homeowner in the towns that we picked. And we've actually had more interest than we're able to satisfy in each town, actually. So through that, we also have, different kinds of education, mostly on our website and flyers, et cetera, to educate homeowners on wells and testing that we didn't get to during the testing season. Also to engage the local board of health in the towns that we were testing with to update their local regulations if they so choose to. Some towns that we worked with had very good local board of health regulations. Some towns didn't have any at all. So, we tried to engage them with that, bring them to the model regulations that MassDEP puts out to try to, as a basis to maybe adopt those. And, assist the boards of health with that implementation if they so choose to. Then provide technical assistance sampling for well owners. We've done this in a number of communities at this point. Testing the homeowners, looking at their wells, giving them the results, giving them recommendations how to make the wells better, treatment, etc. And really the long-term goal of the statewide minimum private well regulation. Local boards of health regulate many public health codes, which are set by minimum standards, a lot by the Department of Public Health, some by MassDEP like Title V, but they set a minimum standard. Local boards of health can be more stringent, but they can't be less. And really just sets a baseline for the health regulations. This is true for the food code, housing code, bathing beaches, camps, Title V, you name it. But for whatever reason, private wells has been kind of left out of this. Next slide, please. So it's just a picture of me and my colleague Perna doing a private well assessment. And like I mentioned, we'll look at the well area itself and any treatment and discuss with the homeowner. Biggest reason why we look at the wellhead itself is we do bacterial testing, and 9 times out of 10, if we do have a bacterial problem, we usually can trace it back to what we see at the wellhead. So in 2021, in 2020 we did a little bit of testing, but in 2021 we really started the testing program, and it was really centered in northern central Massachusetts. We targeted 6 communities listed above. We were working with the Massachusetts Public Health Network and the Neshoba Associated Boards of Health. So we tried to do 3 and 3 of each one of those public health districts, 2 towns at a time. And we based that on the interest that we got from the 2020 sampling. Communities that primarily use private wells. And again, we wanted to get 3 from each health district we were working with. So that's how we kind of chose those communities. Next slide. And as we got the results back, they're pretty eye-opening, if you will. Looking at a strictly apples to apples comparison of health-based contaminants as opposed to secondary or aesthetic standards, if you will, we found that 18% of the samples we took had some sort of health-based accidents. The biggest issue being arsenic. 24 of those 240 samples were exceeded the arsenic standard. Radon as well, manganese, which has Massachusetts has drinking water. MassDEP has a manganese standard above 0.3 milligrams per liter. So we had 6 of those, 5 uraniums, and 2 total coliforms. E. coli's. We did test for total coliform. Total coliform exceedances were much higher. We had 34 of the 240 samples come out. All of those were screened for E. coli. Only 2 of those came out for E. coli. But when you put the secondary standards into it, more than half of the well samples that we took had some sort of flagging by the lab, if you will. pH being the biggest issue, which wasn't not to be expected. Acidic water is very common in Massachusetts. However, it's not a health issue, but pH can lead to health issues in a public drinking water standard. Anything below a 7 is usually a treatment technique violation. Acidic water can leach copper, can leach lead, and then, cause health issues that way. And total coliform bacteria, the secondary standard, 34 of them, that's an indicator bacteria that indicates there is something going wrong with the well. It could lead to E. coli, doesn't mean it is pathogenic at that time, but it's an indicator of a health issue. So those two I wanted to point out, even though the secondary standards. Next slide, please. So we want to get some sort of comparison. So we went to MassDEP and see, what would you have for your standards compared to what we find in private wells. So like we mentioned, we had 18% exceedance for health-based standards. If you add the total coliform in, which is a health indicator of health issue, the samples went up to 27% of the samples we exceeded either had a total coliform or a health-based issue. MassDEP reported an average of 4.5% exceedance of health-based standards in the community public water systems, or the public water systems that serve people's homes, which a private well would be the equivalent, if you will. So you can see there's quite a difference, if you will, between basically the compliance of private wells as composed to a public water system. It's not really compliance because there's no real regulations, but the health issues that could be from the drinking water they're drinking from private wells. There's also pointed out too that private wells are not sampled like a public water system. Public water systems, depending on the size, are sampled at least monthly. Private wells, most of the people we met with have not sampled their well at all, if not when they moved in. So, you could be drinking this water for a number of years, as opposed to a public water system would normally test for pretty much everything once a year. So you might be drinking it for, a whole year, but it won't go to, 20, 30 years we were seeing when we were meeting with the homeowners and asking them when the last time they did a test was. Next slide, please. Knowing, if this moves forward, there's a lot of need for financial assistance. Before this program, and currently we get many inquiries from low-income homeowners that just can't fix their wells. They have a treatment issue and they can't put some sort of system in. We got a few calls this summer, wells that have gone dry. Right now, Massachusetts has a septic repair loan program. We also have a home modification loan program that RCAP Solutions actually administers in Worcester County. Doesn't allow us to do wells. USDA Rural Development does have a home repair program. However, you have to be extremely low income and live in a community under 10,000 to even meet that. So there's a lot more assistance that needed out there for homeowners. Some homeowners just need less than $1,000 for a treatment system. Some other homeowners that have a dug well just went dry, need a substantial amount of money to drill a modern drilled well, and so they don't go dry again or next time we have a drought. And we also know that there's going to be funding that's going to be needed for resources and training. If we get a minimum standard, MassDEP has to develop it and put some personnel towards it. And also, if that standard comes in, local boards of health are going to need training and support to implement that. So there is going to be financial needs in the long run, but at the same time, we think it's a well worth it for the public health benefit. Next slide, please. So 2022 is what we call the implementation year. One of the top things we are doing is trying to lobby and advocate for the bills to be passed that were introduced that we'll talk about further in the presentation. I don't want to go down that road just yet. And also, we've been sampling in 6 towns statewide, 40 samples per each of those communities. We have finished up the sampling in phase 1 and 2. We're going to be starting phase 3 in September, and just waiting for the lab results to finish up the actual tabulations in the 1 and 2. And also trying to expand the leadership and advisory teams and get more people involved. Really the purpose of this call. Next slide, please. So any other questions, please refer to this, or that's my contact information. Feel free to give me an email or call directly, and I'll talk further with you. And I'm going to pass it to Kim, I believe, next.
Great, thanks, Jim. So Lily, if we could have the next slide, that's me, Kim Dash, Principal Research Scientist at Education Development Center. I have been working with RCAP Solutions since 2020 during the planning phase. As Amy pointed out, evaluation is very much integrated into the programs funded through the Synergy Initiative, and that applies to the RCAP private well program as well. So if we could take a look at the next slide, this shows the program's logic model. That was one of the first things we did during the planning phase, was to develop a logic model that demonstrated how the different program activities are connected with anticipated outcomes and the extent to which the program activities actually address factors that are thought to contribute to private well safety behaviors in the state of Massachusetts. So I'm not going to go through the whole logic model. You can see there's a lot going on there, but it proved to be a critical piece in terms of informing how we conducted the evaluation and the kinds of outcomes we wanted to track. So if we could take a look at the next slide. And again, I'm going to focus primarily on the results of the pilot study or the pilot evaluation study rather than the methods. But I'll just quickly say that we engaged six towns that met selection criteria, and we recruited and enrolled 40 households in each town. We conducted a pre and post questionnaire, and we had 80% of participating households to complete both the pre and the post test. And this assessed changes in knowledge, attitudes, and practices related to private well safety, as well as satisfaction with the RCAP services. We also conducted and documented results of 240 on-site well inspections and water tests, and that's what Jim was just reviewing in his segment of the presentation. And we also tracked the proportion of wells tested by town and town-specific regulations. So let's take a look at the next slide. Here we can see that most participating households were really satisfied with the services provided. The one exception was probably having someone explain test results. However, this may be because not all households received results that required explanation. That is, there were no contaminants found. Let's go to the next slide. With the pre and post test, we found that program implementation was associated with improved beliefs favoring well safety and some improvements in knowledge and practices. Only 5% reported having a well assessment as recent as 1 year ago. So that definitely was sort of wake up. Overall, there were significant improvements in beliefs favoring well safety, some significant improvements in well safety knowledge and practices, especially with regard to knowing that well water testing should occur annually, ideally. And then remediation and repair of household wells or well water supply happens subsequent to identification of contamination or structural defects. So half of the households receiving reports of contaminated drinking water reported paying for well remediation afterward. So that's a pretty substantial finding. Let's take a look at the next slide. So as Jim noted earlier, tests of water quality found that 27% of households have levels of contaminants exceeding MassDEP drinking water health-based limits. What this shows is that percentage varied dramatically by town. So as you can see here, for example, rates of contamination were higher in Sterling than in Berlin, Bolton, or Boxborough. Rates were also relatively much higher in Hubbardston and Princeton as well. So again, variation by town, even though the overall, when you average across these towns, 27% is still relatively high. Let's take a look at the next slide. Oh, you're already there. So this slide shows the percentage of households by town that had a drill log, conducted annual testing, had ever disinfected their well water supply, have a permanent treatment system in place, and have a well that meets construction standards. So as you can see, the on-site well assessments found some well and water safety precautions in place and others absent. What's especially notable here is that about 40% of all wells assessed did not meet well construction standards. So think back to those photographs that Amy shared with us earlier. That is sort of a visual representation of some of those structural issues that Jim and others found when conducting well inspection. Next slide, please. We also considered variation in private well regulations by policy type. This included policies or regulations regarding well construction, well design, well maintenance, well permitting and water quality, and well abandonment. We also looked for regulations related to required water quality testing at time of property sale or transfer. We were not able to find private well, as you can see from this slide, we weren't able to find private well regulations for the towns of Hubbardston and Princeton. We note that none of the towns participating in the pilot study had well regulations requiring water quality testing at the time of property sale or transfer, which is often considered a model approach for private well water testing and is implemented in other states, such as New Jersey, where it was found to increase the rate of private well water quality testing overall. All right, next slide. So based on the pilot study, the private well program made a few changes, and these are currently being implemented. The program currently implements on-site well inspections and assessments only in cases where household well water supply screens positive. That's my terminology. Jim has a much more environmentally sound term for that, but I'm saying they screen positive for contamination. And second, the program is exploring ways to provide incentives or low interest loans for remediation and repair of wells as needed. And this is critical given that participants frequently cited cost of treatment as preventing well water testing and assessment. The pilot study also, the findings also have implications for policy. The variation in private well regulations led us to a shift away from educating individual towns on adopting model well regulations to a push for developing, advocating for, and implementing statewide model regulations that incentivize well water testing, ideally via property transfer or sale, as I said, is currently done in New Jersey and in Rhode Island. RCAP also is considering an awareness campaign along with model regulations, given that knowledge of private well safety is still limited. And this was revealed in both our pre and post test. And as Amy indicated, there is a limited amount of data on the number of well water tests conducted. So any regulations or legislations would ideally stipulate an entity responsible for tracking well water tests conducted at property transfer or sale. And finally, one of the other things we have talked about is collecting representative statewide data on well water testing, considering perhaps adding a question to the Massachusetts behavioral risk factor surveillance system, as is currently done in Maine. So again, that's my very quick overview of the results from the pilot study. I'm going to hand it over to, I believe, Amy.
Yes, thank you so much, Kim. So next, I'll share a little bit about our current efforts advocating for stronger drinking water protections and also financial assistance for private well owners. Next slide, please. So currently, in terms of private well regulations across the state, there are none, as we have said. This is despite an article in the Massachusetts Constitution that actually guarantees a right to clean water. Currently, the major challenge to this is that MassDEP lacks the authority to regulate private wells. The agency can really only issue guidance and recommendations, provide technical assistance. It does not have the authority to develop regulations. Next slide, please. And that's because that authority lies with local boards of health. And I'm thrilled that there's so many Board of Health members here with us today and really welcome your feedback in the Q&A session. Local boards of health have the authority to develop local regulations, and many have, but the regulations vary significantly, even between neighboring towns. Some towns have very stringent regulations, others have weaker regulations or outdated regulations. And we have even encountered through this project some towns that are unable to find their regulations and are unsure if they ever developed regulations or not. So currently, under the status quo, the burden lies with the local boards of health to update and enforce local regulations with individual homeowners. And that can be quite burdensome for these volunteer boards of health. Board of Health resources also vary across the state. Some towns may only have a part-time staff person that's shared with other towns, versus larger municipalities may have multiple staff members devoted to these issues. So it can be really difficult for a Board of Health to keep up with ever-changing information. And I think the relatively new and emerging issues related to PFAS just underscores the challenge for a local board of health to keep up with the very latest when things are changing so quickly. Next slide, please. One of the main reasons why the foundation continues to be so engaged in this work is really because our belief that this is a health equity issue. Currently, the patchwork system of local regulations is confusing and inequitable. The reality is that residents that tend to live in more urban areas and have public water systems, their drinking water is regulated by the state and is routinely monitored for contaminants, monthly, sometimes weekly, sometimes even more often than that. And these are regulations that apply to all public water systems in all municipalities. They don't vary depending on which part of the state you live in, which is not true for private well regulations. So residents that have private wells may not test their drinking water. They may not be aware of the importance of doing that, and they also may not have the resources. The funding opportunities are not distributed evenly. Public water systems can often apply for various grants or loans, whereas there are very limited funding opportunities, as Jim mentioned, for individual homeowners and also for local municipalities looking to support their residents. Next slide, please. Just wanted to note an op-ed from earlier this year for those of you interested in learning a little bit more about the challenges and inequities in drinking water protections across the state. So I encourage you to take a look. Next slide, please. And this is a map actually developed by MassDEP as part of its private wells PFAS sampling program, which ended earlier this year. In green, you see the 84 towns in Massachusetts that have 60% or more of residents on private wells. So you can see that they are spread across the state, though there's a larger concentration in Western Massachusetts and Central Massachusetts. Also, what this map does not show is that there are many towns where there are private wells not reaching this threshold, but still a significant portion of residents in town may have private wells. And what we've heard is that oftentimes in those types of municipalities, they're even less likely to have private well regulations because the focus is really on the public water system that the majority of residents have access to. Next slide. So as this project has evolved, we have been looking at examples from other states, as Kim referenced, and also at other examples here in Massachusetts. And we discovered that the example of septic systems is actually a great template for what we're trying to achieve with private wells. I'm sure most or all of you are familiar with the Title V regulations. Prior to that, there were no statewide regulations for septic systems. So it was a very similar landscape to what we have now for private wells. And the issue was that an individual's home that had a failed septic system could discharge raw sewage or sewage that was not treated, and that has environmental and public health impacts. So Title V was passed in order to protect public health and the environment, and it was passed because of the initial first step of authorizing MassDEP to develop statewide septic code regulations. And so that is what we're trying to achieve, is to take the first step in authorizing MassDEP to develop these new protections. Next slide, please. So septic systems also provide a good reference point in thinking about the financial considerations regarding private well regulations and testing. So you'll see in those charts that the costs are quite a bit lower than what one would see for septic systems. You're looking at testing costs of $50 to $300. I've heard that the costs are going up, especially if you include PFAS. So we may be looking at closer to 500 or that range. And then in terms of remediation, failed septic system can cost up to $50,000, whereas remediation costs for private wells ranges from about $1,000 to $10,000. Sometimes a homeowner can install a relatively inexpensive point of use filter just at the kitchen sink. Other times it requires a more sophisticated system for PFAS, for example, that can cost up to $10,000. And this is a challenge for many homeowners with low incomes or fixed incomes. So Jim already ran through many of these options, which frankly don't meet the needs of Massachusetts residents at this time. Next slide, please. So we've been actively working on two pieces of legislation. The first is to authorize MassDEP to develop statewide private well regulations to ensure safe drinking water quality for all. I'll say a little bit more about this legislation, but we expect to have it refiled next session. The second piece is related to the financial assistance and to expand an existing state loan program, which is the Mass Housing Septic Repair Loan Program, to include private well remediation. And this is still potentially in the works this session. I'll say a little bit more in a moment. Next slide, please. So in terms of the authorizing legislation, this again is the first step in the process. It would authorize MassDEP to develop regulations. So an act promoting drinking quality for all was filed last December by Senator Jamie Eldridge and Representative Dan Cena. We're happy to share that language with those of you who are interested. It really is the very first step. So in the legislation itself, there is no specification of what the regulations themselves should be. It merely starts the process of MassDEP developing the regulations with consultation from a technical advisory group and public input. So this bill, the Senate version, was sent to study, and we expect to have it refiled. In the coming months, we are looking to revisit the language and make some revisions. And so we are looking to all of you to weigh in and provide feedback so that this can be a piece of legislation that works for all of you and provides better protections for private well owners across the state. Next slide, please. And in terms of the Septic Repair Loan Program, some of you may be familiar with this program and may have referred people to it. It was originally established around 1995-96, following the passage of Title V to provide financial assistance to low-income homeowners. It was originally funded with $13 million. About $3 million remains. It is a revolving loan fund. So as people make payments on their loans, those funds do go back into the revolving loan fund to provide loans to other homeowners in the future. It's administered by Mass Housing. We were successful at having some language to expand this program to include the remediation of contaminated private wells, approved as part of the Senate Economic Development Bill in July. Unfortunately, the status of that bill is still in limbo, as some of you may have read about in the media. We're hopeful that the bill will get passed sometime this session in the time that remains. And if so, that this provision will be included. But this is a really great step forward, building on an existing program and existing funding. It doesn't require any new funding at this time to really be able to help homeowners now without further delay for those who lack the financial resources to treat their contaminated wells. Okay, next slide. And I think I'll turn it over to Madison now.
Outstanding. Thank you. Big thanks to Amy, Jim, and Kim for their informative presentations. I'm sure after hearing about the scope of this problem and the progress this group has already made, all of you listening are probably very eager to hear about how you can help us make sure that every Massachusetts resident has access to clean drinking water. Well, I'm pleased to let you all know that each of you is welcome to officially join our coalition. You can do so by filling out our Google form that can be accessed via the link my colleague Lily will be posting in the chat, or via the QR code on your screen. I can't actually see the presentation, so I'm not sure if it's on the screen right now, but it is in one of the slides, so we can flip to that one. Once you've joined our coalition, you'll automatically receive regular updates on our progress via email, and we promise we won't flood your inbox. We'll just give you exactly what you need on a regular schedule. So you're not going to be flooded with emails about drinking water. We are planning public in-person events across the state beginning in October and continuing through the spring. So keep an eye on our website and those coalition emails for details regarding those events. We'll be sure to push out those details as soon as they become available. Now we will open up the meeting to a Q&A. If anyone has a question or a comment, please feel free to unmute yourself now and share it.
Hi, Renee D'Argento here. I'm the chair.
Hi there.
Yes, hi. I'm the chair of the Pepperell Board of Health. I noticed that I think in the map that you presented in the beginning, that the coalition doesn't involve Pepperell at all. Is that correct?
This coalition is statewide. So we are including everybody, but the studies that we've already done, the well testing may not include Averill. That I'm not sure. We'd have to bring in Jim to comment on that further.
Okay, I wasn't sure which because now we've had so many slides, whether that was also RCAP's map that didn't include Pepperell in there. In any case, is RCAP or is someone else providing assistance to homeowners for testing for PFAS at all?
Jim, can you answer that question?
Sure. No, currently we have not tested for PFAS. In the beginning we were considering it, but then MassDEP came out with their own PFAS testing program, and also there was a lot of legalities with the waste site cleanup side of things, and what's a 21E site, etc. So, but we still have an EPA program that if there's a homeowner that has a problem with their well, as far as get rid of a bacterial contamination or just wants a well assessment, and we do have some limited funding for testing through that, but we're really reserving it for homeowners that have don't have the means to test, but really have a health issue, if you will. But we have very limited funding for EPA, but we can only test in the 6 communities that we have identified for 2022 as far as this Health Foundation program. I hope that answered your question.
Where do homeowners go if they want to have their private well tested for PFAS?
For PFAS, you'd have to call. What we do, we always recommend a MassDEP certified lab. There is a spot on our website. We'll bring you to the link to that, or you just type in MassDEP, just Google MassDEP certified labs. Believe where you're located, the closest lab is Neshoba Analytical and Air. They, from what I understand, accept PFAS sampling, but then send them out to another lab to be analyzed. But they could be a point place to get the bottles and bring the samples back in. But it would be on the homeowner to, purchase that. And I have heard that those prices have crept up quite a lot because just the demand for PFAS sampling. Now that's a required by public water systems, community systems routinely, and then actually the non-community systems, the non-community transient non-community systems, like stores, etc., all have to test by, I believe, the end of September. So there's going to be an even more glut of people coming in for PFAS testing, if you will. I think there's like 200-300 of those still have to test last time I saw. So there's not a lot of labs doing it, and the need has gone up, so the prices have gone up. Last time I heard for PFAS sampling at a lab down in Middleborough, it's $700 they quoted a homeowner. So it's quite expensive for the PFAS right now, unfortunately.
So I'm sorry, I just have one more question.
Sure. Go ahead.
What would be the, is there a typical cost to remediate a well for PFAS? And I mean, is the technology for homeowners, I know I've heard that it can be really complicated depending on, the soil types or whatever in the aquifer that they're in. So do you have any information on that?
Well, the most common treatment for PFAS now is activated carbon, and they're putting it in. I know a lot of systems, again, put into private wells in affected communities like Princeton, Stowe, etc. There's responsible parties that have to put those in. There's two standards for PFAS. Is the drinking water standard of 20 parts per trillion, which most likely in December will be even lower.
Yeah.
When the EPA standard comes out. You also have the bathing standard, which is very high. I believe it's somewhere in the 200 parts per trillion. Yeah. But usually a point of use for PFAS sampling for the normal 20 parts per trillion isn't that, it's expensive, but not that inexpensive. It's, a point of use filter underneath your kitchen sink with a separate tap just for drinking and eating, if you will, for that, to get rid of that PFAS. If you get those really high levels, which I've seen in some private wells, then it's a whole house treatment. That's much more expensive, because every drop of water goes through the house has to be treated as opposed to just what you're drinking. So it does depend, but usually the drinking water standard, the point of use filter underneath there with activated.
How low can they get? Yeah. How low can they get for the drinking water? Oh, sorry, there was a delay. How low can they get for the drinking water standard? How low can the treatment get? Parts per trillion.
Right now, the best I'm hearing is 2 parts per trillion, and that's what MassDEP actually expects the EPA standard will be. Because once it goes through the review, what I understand, it has to be checked for practicality for testing of the lab and for treatment before they put the final standard out for public water systems to update, if you will. So right now we're looking at 2 parts per trillion, but don't quote me on that. It's whatever EPA decides that standard will be. And that will then trickle down to, that will be the Massachusetts standard. And, being that it's a public water system standard, it usually just trickles down that's the private well standard. By default, most times.
Yeah. Thank you very much.
Mm-hmm.
Hey, this is Bill Pula. Can I ask a question? Or actually some comments?
Hey, Bill.
Hey, Jim. I'm the chairman of the Board of Health in Pelham, Mass. Tiny town, 1,400 people. We were lucky. We had the DEP PFAS testing in town, plus RCAP came by and did 40 wells for the general chemistry testing. My experience, because we started this 2 years ago, the PFAS. So we tested. We could have done up to 40, and people drop out along the way, but we did tested 38 wells. We have no obvious source in town at all. We're very rural. Half of Pelham's in the Quabbin watershed. And the other parts of it are in the Amherst watershed. So it's very rural town, no industry at all. One sort of major route through town, which is a 2-lane highway. But so we did 38 wells. We got 4 positive results, 2 above the current MCL. So one person, the spot, it's, it really can't figure out where it came from. It's a very rural spot. It's not even near any big roads. It's up on top of a hill, on top of a ridge line in town. She had one of about 30 parts per trillion. So she got very mixed advice from the state on this, really. And I did some of the research myself on it. So she put a Pioneer GIC whole house filter in. It wasn't, it would cost about $3,000 to do it, $3,000 to put it in. This is treating all the water in the house. It's supposed to treat 100,000 gallons for maybe the last 2 years. Replacement cores for that. I mean, you got, the basic setup. The filter costs maybe $1,300. Then you have to have a plumber put it all together. And you put a big sediment filter in front of it. And once you have it all installed, the replacement cores cost like $300 to sort of recharge the GAC, granulated activated carbon. And the problem is, once you put it in, does it really work? So this woman, I've been working with her closely on it. I've gone and seen the installation, and so she wants to do testing. The DEP told her to put 2 of these systems in, with a tap in the middle. Would have come close to doubling the price. Instead of $3,000, would have at least added another $1,500 or so to it. So you'd have 2 systems. You'd test in the middle till you got breakthrough on the first filter. Then you'd have the second filter to work, and you could change the GAC on the first filter. But so you only put 1 in. You can currently, I talked to a bunch of labs. The labs that did the testing for DEP are not doing testing on individual homes. The only one that's doing it is the lab in Air, I think, that one I talked to. He's the one that was going to charge $400, $450 for a test, and they charge $250 for a blank. So that comes up with the $700. The blank you have to do if you're going to do any legal thing or go to DEP with. She found another lab, PACE, P-A-C-E, that's doing hers for $299. So she got the system installed, she's using it, and she's sending off a test today or something, or tomorrow. So, I mean, that's my experience with it, dealing it in the local level. I mean, I have a long time. I used to work for DEP, then I was a manager at Co-op, and I've worked in water for 40 years. So I'm acquainted with all the stuff. So that's my experience with it so far. I mean, I think the big problem is testing after you install it. When I talked to UMass, they say it's good for 100,000 gallons. Nobody knows. Nobody knows what the carbon loading on the filter will be. If there's other total organic carbon constituents in the water, it'll breakthrough will happen quicker. There's only so many sites on the carbon to take up. So that's my experience anyways. And luckily we tested 40 wells, RCAP tested 40 wells. My well came clean up on both, so I'm all set. My old personal well. But I think annual testing, I would agree that annual testing, at least for BACT, total coliform E. coli. But a lot of those other things, I don't think they change that much over the year. Labs say once every 10 years for some of them, for some of the other constituents. So that's all I have to say. I'll shut up now.
Yeah, the manual we send out, which is from MassDEP, Mass Associated Health Boards, and EPA. There's a flyer with our testing recommendations. Is bacteria nitrate yearly, and then everything else every 5 to 10. So you're right on there.
Yeah.
Now that doesn't include PFAS as of now. So that's as of right now. When we give follow up to all the homeowners we meet with, everyone gets a copy of that flyer with testing moving forward. We hope they test moving forward. It does not include PFAS. So until that changes, the recommendations we are is, what the government agencies are telling us to give to the public, if you will.
Yeah, that's a lot more expensive.
Yeah.
You do the BACT test for, I don't know, $30 or something, probably, right?
Oh, big time. Same thing with VOCs and gross alpha. Those are also they're also recommended in that flyer that we give out. We don't do them because of the cost. The VOCs just as much as everything else we do. But
Okay. Does anyone else have any questions or comments they want to share before we adjourn the meeting? Okay, doesn't sound like it. So again, everybody, thank you so much for joining us today for the past hour. I want to apologize for the technical difficulties that delayed our start, but I think we got through all the material we wanted to and made a good connection with this group here. Again, please don't hesitate to reach out to us for any follow-up questions you may have, and don't forget to fill out the Google form to join our coalition officially. Thank you all so very much for your time.